We heard from Nicole and Megan about their experiences using IUDs. And Dr. Jen, I want to get into just, there's such different stories, such different, outcomes with their IUD experience. Why aren't people being warned about the possibility of significant pain or complications that come with IUDs?
Well, I think that medicine in general has a communication issue, and sitting down and explaining what's actually going to happen with the IUD insertion should be part of it. A lot of people don't realize that there has to be a speculum that goes in the vagina. It's going to be cranked open really wide, that we may have to use an instrument to stabilize the uterus. There are pain control mechanisms that we can use. We can put numbing medicine around the cervix. We can give people a medication for anxiety if needed. Having a person there with you as almost like an IUD doula can be helpful. So there are many things that can do. You know, anxiety also makes pain worse. So if you don't know what's going to happen to your body, there are some people who are more likely to have pain with insertion, people who have pain with sex, or people who have pelvic pain. So we want to know about it. So that's all that communication is super important. What the data tells us is about 50% of people have very, what we would call mild to moderate experiences, meaning their pain scores are 5 or less. And obviously for them, they don't need very much. There are other people who are going to have higher pain scores, and for them, more things might be needed. And that's okay. You need the pain control you need.
You need what you need. Dr. Tony, what are typical and atypical side effects after insertion?
Yeah, it's helpful to know what you're signing yourself up for. Typically, like Dr. Gunter was saying, it can be painful during the actual insertion. I usually say it's, crampy, possibly sharp pain, like a bad period. This is normal. Okay. And then afterwards, what to expect. Usually, again, cramping can last, usually some women it's a few hours, some it can be longer, 24, 48 hours. I would say this is normal. Slowly improving over about the course of a week, I'd expect people to sort of be back to their baseline. Other things to know, after an IUD, there can be spotting. This is normal. We've done a procedure. We've gone into the uterus. Spotting right after, totally normal. With the hormonal IUDs, that spotting can actually last quite a bit longer because of the progestin that's in there, thins the lining, and so you can have some shedding that goes on for sort of 3, sometimes up to 6 months, and this is considered normal.
Okay.
If you are having heavy bleeding, so like severe bleeding, you're soaking through a pad more than every hour for more than, a couple of hours, this is not normal. You should be seeking medical attention. Really severe pain out of the ordinary that is excruciating. Again, these are not normal things. I would seek medical attention.
Spotting that goes on for years? Is this normal?
This is not what I would consider normal.
Okay.
There's always going to be outliers when we talk about what different people are experiencing. And unfortunately, sometimes that is the case. It is not often. I wouldn't say it's typical, and I would certainly say, you want to make sure that you've been checked out and that's been worked up. Make sure there's no other problems happening at the same time.
Also, for people who are having persistent spotting, there are medical therapies for that. There are things that we can do to stop the spotting, right? Now, again, there are always outliers, and there might be people those things don't work for, but it's very important to know the things that we can do. And when people have, that pain experience that we heard about that took you back to the emergency department, it's super important that the doctors actually investigate to find out why that pain is going on. Because many people who have a lot of pain after an IUD insertion actually develop muscle spasm around the vagina, because when the speculum's inserted and it's opened really wide and you have that painful triggering, it can actually cause that muscle spasm. And so there can be also other things that could be triggered as well, but so we would want someone to actually get a proper evaluation, and that's awful. Somebody shouldn't be shunted from ER to ER. They should be seeing someone who understands about pain, who can take that seriously.
So you have to just keep going until someone gives you an answer?
Well, yeah, I mean, you should be asking to be referred to someone who can give you an answer,
Okay, that's fair.
Yeah, I mean, and it's not, that onus shouldn't be on the patient. If I'm a doctor in the emergency department and someone's coming in over and over again, I should be looking at who I can send that person to so they can get help. If I'm the gynecologist and I can't explain their pain, I shouldn't just say, oh, well, I don't know. You should look for the person who can help with the explanation.
Absolutely. So there is a call for better pain management. What are the options that can be asked for, Dr. Tony?
Yeah, I mean, it really depends. I think it's important to have a conversation with your provider to explore what options are available, because some of us have access to different things. So for instance, in my office, we talk about things like painkillers before you come in for the procedure, so Tylenol, Advil. I personally like naproxen because it tends to work better for the cramping after the insertion. Some of us have access to the numbing agents that Dr. Gunter was talking about, so lidocaine, either a lidocaine spray or an actual injection into the cervix, which can be quite helpful in reducing the pain. And then other things like breathing techniques and having someone there with you and just having a good explanation and an understanding of what's going to happen so that your anxiety is already lower. This is also tremendously beneficial. And then there's also these severe cases where people know that they have severe pain maybe going into it. that aren't going to be appropriate to do in my family doctor's office, and that's when I would refer to an obstetrician gynecologist because they have more options available to them.
Yeah.
Okay.
And I think, you know, it's also important to just really go through the options. Some people are like, look, I don't want to have to take any time off work. Other people are like, I don't want to have any pain. Everybody has different things, how they feel about it. And so it's important to kind of talk about that beforehand. Also, I tell people if you have a TENS unit, bring it in. So TENS units are very effective. Well, they help menstrual pain. They're quite effective. They can reduce pain scores by about 10%. And so I'll tell people you can put it on during the IUD insertion too. And it's just kind of another little trick.
What is it?
So it's a device that it's like got a little battery pack, and it's got little pads that you put, you know, over your uterus or over the front or over your lower back, and it sends an electrical impulse to the nerves and muscles, and it reduces pain. If you go to my website, the Vagenda, I have actually pictures of where you would put it. And there's a study that shows that it reduces pain with medication abortion. So if it reduces pain from that, you'd think that it could possibly help with IUD insertion as well. And so I recommend people try that as well.
That's good. Okay, thank you so much for this conversation. We're going to have a list of things you should discuss with your doctors about IUDs on our website. Go to cityline.tv for